This presentation is to talk about heart sounds. We would recommend that you listen to the heart sounds through a high quality headphone with the volume turned up pretty far, or you may not be able to appreciate the various auscultatory findings. The audio files noted as Heart Sound Simulator, or HSS, are from a machine that creates heart sounds. The other ones are from animals where we've tried to record the heart sounds. Normal heart sounds are S1 and S2. S1 is a result of closure of the mitral and tricuspid valve and oscillation of the heart and great vessels, and is usually heard best at the cardiac apex. On the phonocardiogram, which is depicted in the lower right, the first heart sound happens shortly after the onset of the QRS. S2 is a result of closure of the aortic and pulmonic valve and oscillation of the heart and cardiohemic structures. S2 is usually heard at the base of the heart and happens around the time of the T wave on the phonocardiogram. Let's go ahead and listen first to a normal heart sounds from a dog. That was recorded from the heart apex, and S1 is just a little bit louder. Let's listen to a normal dog again. This time we're going to listen at the heart base, and the second heart sound is going to be a little bit louder. This next recording is meant to mimic a normal dog using the heart sound simulator. The heart sound simulator makes S1 and S2 sound just a little bit too tympanic, but let's give a listen anyway. And next, let's listen to the heart sound simulator trying to mimic a horse heart rate. The heart rate is slow. And finally, we'll listen to the heart sound simulator's attempt to make cat heart sounds. The sounds are a little too tympanic and they last too long for a cat, but the faster heart rate gives you a feel of how fast a cat heart might beat at. Let's talk about variations to normal heart sounds, S1 and S2. S1 is sometimes split in large breed dogs. Let's give a listen to that. And the next thing we're going to listen to is the fixed splitting of the second heart sound, as might be heard with either an atrial septal defect or pulmonary hypertension. Now the heart sound simulator is trying to create a loud second heart sound for us, so a loud or pronounced S2. An S3 sound or S3 gallop occurs in early diastole, shortly after the second heart sound. It's a result of blood flowing very quickly into the ventricle and then the ventricle oscillating. If S3 is heard and is thought to be normal, as might be heard in people, cattle, and horses, it's often referred to as an S3 sound. When S3 is pronounced or thought to be associated with disease, it's called an S3 gallop. And S3 gallops are all that we hear in dogs and cats. Dogs and cats never have a normal S3 sound. Whereas if we heard an S3 sound in a horse or cattle, we might call it that if they thought the heart was fine, but if they had congestive heart failure, we'd probably call it an S3 gallop. Let's listen to an attempt of the heart sound simulator to create an S3 sound in a horse. And now the heart sound simulator is going to try and create an S3 gallop in a dog. Now the heart sound simulator is going to create an S3 gallop, and then we're going to take it away so that you can hear the difference between an S3 gallop and just S1 and S2. And finally, we're going to listen to an S3 gallop in a cat. This cat also has some arrhythmia on this recording. An S4 sound or S4 gallop can sometimes be heard in large animal species, but in dogs and cats, when an S4 is present, it's always referred to as a gallop since it's abnormal. An S4 gallop is a result of contraction of the atria into a stiff or hypertrophy of the left ventricle and resulting oscillation of the heart. It's a late diastolic sound occurring shortly before S1, and an atrial gallop or S4 gallop is often associated with hypertrophic cardiomyopathy in cats. We'll start by listening to an S4 sound that comes and goes. And we'll listen now to an S4 that comes and goes with a slightly faster heart rate. We'll listen now to a mid-systolic click. A mid-systolic click is a result of a valve prolapsing or tenting up in mid-systole towards the atrium. This is a sharp or snapping sound, and it happens between the first and second heart sound. It's often heard with degenerative mitral or tricuspid valve in dogs or horses. We'll listen to a mid-systolic click that comes and goes away on the heart sound simulator next. And we'll listen to a dog with a mid-systolic click. The dog also has sinus arrhythmia. And the final recording on this slide is a dog with a mid-systolic click that also has a soft murmur. The sounds described to this point in time are also referred to as transient sounds, as they are very short in duration, but longer sounds are described as murmurs. Murmurs result from turbulent blood flow within the heart or great vessels. Murmurs can be physiologic in origin, which would be normal, or they can be pathologic. Of course, that would mean they're abnormal. Physiologic murmurs are generally softer, usually 1 or 2 out of 6 in intensity. Murmurs can be classified by timing within the cardiac cycle, and the first murmur we'll listen to is a systolic murmur. This murmur happens between S1 and S2. The next murmur we'll listen to is a diastolic murmur. Diastolic murmurs may occur as a result of leak at the aortic or pulmonic valve or abnormal filling during diastole at the mitral or tricuspid valve. Diastolic murmurs are often soft and typically have a decrescendo component. And finally, we'll listen to a continuous murmur. This is a murmur that happens all the time and lasts throughout the cardiac cycle. We already mentioned about murmur grades, and murmurs can be graded 1 through 6. A 1 out of 6 murmur is present after listening to the heart for 1 or 2 minutes in a quiet room with a compliant animal. So this requires listening for some significant period of time if you're going to hear a 1 out of 6 murmur. This may be also known as a cardiologist's murmur. 2 out of 6 murmur is a soft murmur noted soon after the beginning of auscultation. We hope most students who are graduating are able to hear a 2 out of 6 murmur. 3 out of 6 murmur is a medium intensity murmur, and most fourth-year students who are entering in clinics can readily identify this as an abnormal sound. 4 out of 6 is a loud murmur, but without a palpable thrill. 5 out of 6 is a loud murmur with a thrill. You put your hand on the chest and you're able to feel the vibration that's created by the murmur. A 6 out of 6 is a loud murmur with a thrill that can be heard when the stethoscope is removed just a tiny little bit from the chest wall, or when the owner says, when I'm in bed at night I can hear my dog's murmur. That's also a 6 out of 6. Systolic heart murmurs can be divided into regurgitant quality murmurs, which are band-shaped murmurs. They're also called holosystolic murmurs, and they have a relatively even tone throughout systole. These murmurs are often associated with either mitral or tricuspid regurgitation. This murmur is from a dog with mitral regurgitation that also has sinus arrhythmia. Systolic ejection quality murmurs are diamond-shaped or crescendo decrescendo murmurs. They get louder and then softer. These are usually harsher murmurs associated with stenosis across the aortic or pulmonic valve. And finally, we'll listen to a dog who has a ejection quality murmur as a result of subaortic stenosis. Diastolic murmurs occur between S2 and S1 in diastole. Sometimes horses have innocent murmurs, typically low-grade and low-frequency diastolic flow murmurs. A diastolic decrescendo murmur is a murmur that is louder at the start and then gets progressively softer. And this is perhaps most frequently associated with aortic regurgitation, but also sometimes associated with pulmonic regurgitation. A diastolic decrescendo murmur is a common murmur in older horses due to degenerative changes of the aortic valve. A diastolic decrescendo murmur of aortic regurgitation can also be heard in dogs and cats and horses when they have bacterial endocarditis of the aortic valve. So for starters, we'll listen to a diastolic decrescendo murmur at a somewhat slower heart rate. And next we'll listen to a diastolic decrescendo murmur on the heart sound simulator that comes and then goes away. And finally, we'll listen to an elderly horse with aortic regurgitation that has a diastolic decrescendo murmur. Another murmur is a continuous heart murmur where the abnormal sound is continuous. There's no break in the murmur sound at all. This typically indicates continuous blood flow throughout both systole and diastole. Continuous murmur is most frequently heard in animals with patent ductus arteriosus, PDA, where there is continuous murmur and continuous blood flow from aorta into the pulmonary artery. A PDA murmur is best heard very high in the axillary region at the left heart base. Continuous murmurs are also sometimes heard with arteriovenous fistulas or malformations. This first continuous heart murmur is one where the murmur is louder at the beginning and then the murmur is softer so that you can hear S1 and S2. And this next one is recorded from a dog that has PDA. The next murmur to talk about is a combination of a systolic ejection quality murmur and a diastolic decrescendo murmur occurring in the same animal. This is sometimes referred to as a to and fro murmur. Typically, there is a remarkably short break between the systolic and the diastolic murmur, and the systolic murmur is classically much louder than the diastolic murmur, which is typically very soft. The diastolic murmur is often not much louder than the background hum of the room that might be created by the lights or by a computer. Usually this is a result of a stenotic aortic or pulmonic valve that also leaks. So aortic stenosis with aortic regurgitation or pulmonic stenosis with pulmonic regurgitation. This is an uncommon murmur in veterinary medicine. The first one I'm going to listen to is a to and fro murmur from the heart sound simulator. And the second one we're going to listen to is from a dog that has a systolic ejection quality murmur and a very faint diastolic murmur. The next important thing to know is murmur locations. The location of the murmur is often helpful in trying to determine the origin of the murmur. On the left side of the chest, the term PAM or PAM has been proposed to describe P for pulmonic, A for aortic, and M for mitral. On this picture, the blue is the location of the pulmonic valve, green the aortic valve location, and red the mitral valve location. In general, the pulmonic and aortic valve are towards the heart base, up in the axillary region, and the mitral valve is a little bit lower and further caudal around the 5th or 6th intercostal space. The region right by the sternal border is where cats often have murmurs heard best, either on the left side of the chest, just at the sternal border, or on the right side. So often if you listen to a cat right at the sternum and inch a tiny bit to the left or the right, that's the best way to pick up a murmur in a cat. The picture on the right is from a dog again, and the blue circle is the approximate location of the tricuspid valve, which is usually heard best on the right side of the chest. Cardiac arrhythmias are usually first noted on the basis of auscultation, with an abnormal rate or rhythm jumping out at you. Different arrhythmias may have different auscultatory findings. The first one we'll listen to is sinus arrhythmia from the heart sound simulator. Sinus arrhythmia is a normal rhythm in dogs. It's rarely heard in cats in the hospital. Can be heard in horses with speeding and slowing of the heart rate, often in association with respiratory changes where the heart rate speeds on inspiration and slows on expiration. It's important to recognize sinus arrhythmia as opposed to identifying it as something as potentially abnormal. The next one we'll listen to is atrial fibrillation. So we have two recordings from dogs. This second dog that we're going to play next also has atrial fibrillation. Both of these dogs also have a faint gallop, but note the marked irregularity of the heart rhythm. The next thing we'll listen to is a ventricular premature contraction or ventricular premature depolarization. Typically this occurs when there is sinus rhythm and then there's an interruption with a single ventricular premature depolarization. The heart sound simulator can only create so much, and that's what I have recorded. Here is the heart sound simulator, so we'll listen to that. Next thing we'll listen to is a horse who has a diastolic murmur from aortic regurgitation and also has second degree AV block. So as you listen to this recording, you'll hear the normal rhythm and then you'll hear a particularly long pause with a very long phase for the diastolic murmur. And finally, we'll listen to a heart sound simulator recording meant to identify an animal with third-degree AV block, a relatively fast ventricular escape rhythm, but you may be able to notice soft S4 sounds between the S1 and S2. In this next section, we'll present heart sounds as part of cases. So there'll be information on the slide. We'll give a heart sound and then we'll advance it to get additional information. This picture shows radiation of a murmur all the way up to the top of the head of the dog with aortic stenosis. Our first case is a dog with a loud murmur, a 6-month-old female golden retriever who was presented originally for vaccination where a murmur was heard. This murmur is heard well at the left heart base, radiates wildly across the chest, both sides of the chest, and the dog has weak arterial pulses. So we'll play this murmur first. So can you appreciate a murmur? Is it systolic? Do you think it's ejection or regurgitant quality? Or is the murmur diastolic or continuous? Do you hear any other abnormal sounds, or is there cardiac arrhythmia? If it's cardiac arrhythmia, is it a bradycardia or tachycardia? This dog had subaortic stenosis with a loud ejection quality systolic murmur. So a crescendo, decrescendo murmur, heard best at the left heart base. Dogs with subaortic stenosis often have the murmur heard best at the left heart base, and it often radiates to the right heart base. It sometimes radiates up the carotid arteries as well. The ECG shows a left ventricular enlargement pattern with SC segment depression from a dog with aortic stenosis. And the angiocardiogram picture shows the narrowing below the aortic valve as well as hypertrophy of the left ventricle. Our next case is from a 6-month-old female Havanese that has a very loud heart murmur, heard well at the left heart base in the axillary region. Dog also has bounding arterial pulses. This murmur might be a little bit harder to hear, but this is a continuous murmur, and it can be missed if you're not ausculting closely enough. The first angiogram on the left shows the PDA, and the second one shows an ACDO placed in the PDA. And the lower right panel shows continuous flow through the PDA. Let's listen one more time for a second here. Our next case is a dog with a loud heart murmur. This is a 2-year-old intact male pit bull who presents for syncopal episodes associated with exercise. This murmur is heard well at the left heart base. It also radiates widely. This is the dog with pulmonic stenosis. It has an ejection quality systolic murmur, a crescendo decrescendo murmur, which is usually heard loudest at the left heart, at the base, over the P location or the pulmonic valve location. We'll listen one more time here for a second. The echo shows the right ventricular outflow tract with turbulent flow across the pulmonic valve in systole, and in diastole there's leak back across the pulmonic valve, and there's a post-stenotic dilation of the main pulmonary artery. This next case is a 9-year-old St. Bernard who presents for lethargy and cough. Findings on exam include some abnormal auscultatory findings. The dog has slightly weaker than normal arterial pulses with pulse deficits and mild dyspnea. Let's listen to the recording from auscultation. So this dog has dilated cardiomyopathy with congestive heart failure and atrial fibrillation. The rhythm is irregularly irregular and is faster than normal. Let's listen again one more time. The echo on the left shows an animal with dilated cardiomyopathy. There's a little pleural effusion, but dilation of all 4 cardiac chambers and reduced contractile function on a long axis echo view. And on the short axis echo view, we again see dilation of the right ventricle and the left ventricle with reduced contractile function and pleural effusion. There's an alternate case, another animal with atrial fibrillation to listen to. Let's give that a quick listen. The next case is a cat with dyspnea, a 14-year-old domestic short-hair cat. The presenting complaint is difficulty breathing. The cat has jugular venous distension and a thyroid slip. Let's give a listen to the recording. That recording had a cardiac murmur and a gallop in a cat with congestive heart failure. An S4 Gallop is seen most frequently with concentric hypertrophy of the left ventricle and indicates reduced ventricular compliance. sometimes seen in cats with hypertrophic cardiomyopathy, especially in cats with left atrial enlargement. The echo panel on the left shows concentric hypertrophy of the left ventricle, and the echo panel on the right is a picture of the aorta and a markedly enlarged left atrium. Here's a Gallop case to listen to as well. Sometimes Gallop sounds can come and go and thus be intermittent and intermittently ausculted Gallop. This last case is a 13-year-old spayed female dachshund who presents for dyspnea and cough. A thrill is palpated over the left apex. We'll listen to the recording. This is a recording of a murmur from a dog with congestive heart failure and degenerative mitral valve disease. It's typically is a holosystolic regurgitant quality murmur. This murmur is not reproduced this well, but towards the end of the recording, you can hear a little bit better the systolic murmur. The dog has significant cardiac enlargement, left atrial enlargement, and pulmonary edema. We'll take a look at the echo image as well, and you can identify the aorta in the center as a circular structure, the left atrium at the bottom. There's marked left atrial enlargement, some right heart enlargement as well, and the pulmonary artery is a little bit bigger than the aorta. Let's listen to this same dog, this time with some arrhythmia caught on the recording. Listen for the regular rhythm at the beginning, and then there'll be just a little bit of a hiccup as a result of a couple of premature depolarizations. Thank you.